They tell you the screens are the enemy. Your phone, your laptop, your TV. You've probably said it to your own kids. But here's what almost nobody in a white coat will admit to you. The things wrecking your vision the most aren't the glowing rectangles. They're small, ordinary habits you do every single day and never think twice about. One of them can quietly walk you toward blindness. Another one, about 10% of the 15 million people blinded by cataracts around the world, did to themselves. And you're doing at least one of these right now. I'm Thomas, and I've spent 15 years watching this happen to real patients. Here's the thing they won't bring up at your next appointment. The system makes money when you stay sick, not when you protect yourself for free. Subscribe and hit like if you want the straight version. Help me get this channel to 300,000 subscribers. Let's start with the one that looks completely harmless. Rubbing your eyes. You feel an itch, you rub, and what's the big deal? Everybody does it. But stop and think about what those hands were touching a minute ago. A door handle, your phone, money, a keyboard. They're not clean. When you rub, you're taking whatever bacteria and dirt is on your fingers and pressing it straight into your eye. That's how you get bacterial conjunctivitis, an infection of the thin, clear tissue that covers the white of your eye and the inside of your eyelid. Redness, discharge, misery, and you did it to yourself. Now take it further. If your eye was recently operated on, or you took any kind of hit or injury to it, rubbing means you're mashing a fragile healing structure and handing an infection a wide-open door. But here's the part almost no one warns you about. Big studies published in the journal Cornea and in the Journal of Cataract and Refractive Surgery show that chronic, repeated eye rubbing can actually trigger a disease called keratoconus. Let me put that in plain terms. Keratoconus is a progressive weakening of the cornea, the clear dome at the very front of your eye that focuses light. Over time, that dome thins out, loses its strength, and starts bulging forward into a cone shape. Your vision distorts and blurs, and in the worst cases, it takes you all the way to blindness. And if you already have keratoconus or even a mild early form that hasn't shown symptoms yet, constant rubbing will push it into full-blown decompensated disease in almost 100% of cases. Think about that. Something as dumb and automatic as rubbing your eye can cost you the front window of your eye for good. This matters most with kids. They rub constantly, and nobody stops them. So watch your own hands and watch your children's. If their eyes itch, don't let them grind away at them day after day. Find out why they itch. Is it allergies? Is it conjunctivitis? Is it another infection? Treat the actual cause. I'm not telling you to never touch your eyes. That's fine. I'm telling you a chronic rubbing habit is the thing that turns dangerous. Which brings me to the next thing you're probably ignoring. Sunglasses. Listen to these numbers. Around 15 million people in the world are blind from cataracts, and about 10% of them got that cataract purely from letting too much ultraviolet light into their eyes over the years. A cataract, by the way, is a clouding of the lens inside your eye, the natural focusing lens that's supposed to stay crystal clear. So sunglasses aren't a fashion accessory, they're a medical necessity. Your lens can block part of the light spectrum, but a certain slice of ultraviolet gets through to the retina, the light-sensing layer at the back of your eye, and that light is toxic. Toxic to your lens and toxic to the delicate receptor cells that let you see it all. Too much ultraviolet doesn't just cause cataracts, it attacks the macula, the small central part of your retina that gives you sharp, detailed vision and that leads to age-related macular degeneration, which slowly eats away your central sight. But you have to pick the right sunglasses, or you make it worse. Look for a label that says UV 400 or 100% UV protection. That tells you the lens actually blocks the harmful ultraviolet spectrum. Here's the trap with cheap street vendor shades. They darken the picture, so your pupil, the black opening in the center of your eye, opens up wider to let more light in. Now an even bigger dose of ultraviolet pours into exactly the structures you're trying to protect. Dark lenses with no real UV filter are worse than no sunglasses at all. Good glasses also shield the skin around your eyes and your eyelids from the same damage. And don't think this is only a bright summer day problem. The real danger climbs when you're up in the snow and the mountains on a clear day because light bounces up at your eyes from every direction off the white ground. There's a reason serious climbers wear those big wraparound glasses that curve around the sides of the face. It's not a look, it's coverage from every angle. Pick a frame with large lenses that hug your face and you protect the whole eye. Now the third habit, contact lenses. Plenty of people wear them for years with no trouble, and everyone knows the rules. Don't sleep in them. But you'd be shocked how many people break that rule constantly. So what actually happens when you sleep in your contacts? A contact lens is basically a foreign object sitting on your eye, and it blocks nutrients and oxygen from reaching the cornea. Remember, the cornea has no blood supply of its own. It gets everything it needs from your tear film and straight from the air. Put a lens on top of it, even one rated for high oxygen flow, and part of that oxygen still can't get through. The cornea starts to suffocate. That's called hypoxia, which just means not enough oxygen. Now close your eyelid on top of that for 8 hours of sleep, and the suffocation gets far worse. When the cornea is starved like that, it fights back by growing new blood vessels in to bring oxygen tissue that isn't supposed to be there, and the risk of infection climbs because your tears aren't washing the space clean anymore. The harmless microbes that live on every eye surface can turn dangerous and cause conjunctivitis at best or keratitis at worst, which is inflammation of the cornea and a real threat to your sight. A study published in the journal Eye and Contact Lens in 2021 found that people who slept in their contact lenses had a keratitis risk 6 to 8 times higher than people who only wore them while awake. And 30% of the people surveyed admitted they sleep in their lenses, gambling on an eye infection every single night. So if you wear daily lenses, wear them for one day and throw them out when you get home. Don't stretch them. If you wear planned replacement lenses, respect the replacement date. Keep them in fresh, clean solution and check that the solution itself hasn't expired. And never ever swim in open water or a pool with your contacts in. Water is a source of infection. If one particular bug gets trapped between your lens and your cornea, you can end up with acanthamoeba keratitis, a brutal infection that, in some cases, leads to total loss of vision and the need for a corneal transplant. Parents, watch your kids on this one. No matter how mature your teenager seems, they're still a kid, and they don't always grasp the risk they're taking with their eyes. Fourth habit, and this is the one full of hypocrisy. We nag kids about screens all day, then set a far worse example ourselves: smoking. You already know it drives lung cancer. What you probably don't know is how directly it goes after your eyes. Here are 4 eye diseases smoking sets you up for. First, age-related macular degeneration. Again, an analysis published in the British Journal of Ophthalmology covering 40,000 patients found that smokers had roughly 2 to 3 times the risk of developing it. And here's the sting: the risk only came back down in people who quit, and not until 15 to 20 years after they stopped. Second, cataracts. Tobacco smoke is loaded with oxidants and tiny particles that damage the lens and cloud it years earlier than it should. Third, glaucoma, a disease that slowly damages the optic nerve, the cable that carries vision from your eye to your brain. We think of glaucoma as an old person's problem, but smoking can bring it on much younger by cutting blood flow to the optic nerve and raising the pressure inside your eye, and glaucoma never leaves. It's a lifelong condition, so any trigger like smoking has to go. Fourth, diabetic retinopathy. If you have diabetes, especially poorly controlled diabetes, damage to your retina is coming sooner or later. Add smoking on top, and that damage shows up earlier, hits harder, and takes your vision more permanently. The eye is a densely vascular organ packed with tiny, fragile blood vessels. Smoking makes those vessels spasm and clamp down, and everything from your lens to your retina to your optic nerve pays for it. The fifth habit is the quietest one of all: going years without seeing an eye doctor. You figure, I see fine, nothing hurts, I don't need glasses, I drive and read, no problem. Why bother? But an eye doctor isn't just the person who writes you a glasses prescription. Modern eye care is high technology. In a few minutes, we can examine your eye down to the microscopic level and, in most cases, catch a disease before it causes a single symptom you'd ever notice. That's everything when it comes to conditions like macular degeneration, glaucoma, and cataracts. It's far better to catch it early and stabilize it than to meet a patient at the terminal stage when there's nothing left to do, and here's exactly why age is the part you can't ignore. According to the American Academy of Ophthalmology, about 40 to 50% of people who have glaucoma don't know they have it. We can't cure glaucoma, we can only lock it down and stop it from getting worse. So the age we catch it decides how much sight you keep. Your risk for all of this climbs sharply with each decade, and the symptoms and the way you respond to treatment shift as you get older. So tell me, how old are you? Drop it in the comments. I honestly want to see which age group most of you fall into, because it tells me who's most at risk right now and helps me make the videos that actually fit where you are. So here's what you do after this video. Stop grinding your eyes, and if they itch, find the cause instead of rubbing. Buy real sunglasses with a UV 400 or 100% UV label and wear them, especially in snow and bright glare. Follow the rules on your contacts. Never sleep or swim in them. If you smoke, this is one more hard reason to stop. And if you're over 40, get your eyes checked every 2 to 3 years, even when they feel perfect, because the diseases that steal your sight do it in silence. Your doctor won't sit you down and walk you through any of this because there's no money in keeping your eyes healthy for free. I'll tell you the truth, they won't. Subscribe, leave a like, and help this channel reach 300,000 people who deserve real answers about their health.